All right, so we're getting started. We've got quite a few participants already. We're a couple minutes late, but I'm happy to have everybody here. So this is working with kids with ADHD or ADD. Those are common phrases. We'll talk about what those really mean and hopefully get rid of some of the myths and get to some of the truth about attention deficit issues for kids that we probably deal with a lot in martial arts. And on the call, I've got Master Amanda Olson, Master Laura Sanborn. Hopefully pretty soon we're going to have a special guest that I didn't announce earlier, Grandmaster Jeff Smith, a 7-time world champion, is going to be with us, 10th degree black belt. So I'm really excited. Hopefully he'll be here pretty soon. And also Bob Dunn, who's National Director of Martial Arts Wealth Group, should be here. We may even have some other special guests popping in with us. So we've got a ton of participants already coming in. So we're going to go ahead and get started as people start logging in and getting to the call. I generally tend to get a bunch if I'm distracted a little bit, I tend to look at the beginning of these things at my email and text to make sure that people got the messages with email spam and email problems and links. I keep getting messages that people didn't get the links, even though they should have gotten reminded. For those of you on the call, I occasionally get messages saying, hey, why'd you email me so much? Well, I emailed so much because I get a lot of emails saying, hey, we didn't get the links or we didn't get the emails, and that's why I have to keep reminding everybody a bunch. So let me get started here. So the first thing I'd like to suggest to everybody that's on the call is get a sheet of paper out and put to the side and really make a to-do list of what you want to do in your school. Whenever I do a seminar myself or any kind of thing that I'm sitting in a room, I get two sets of ideas. One set of ideas I get are from whoever's talking and from the material from the seminar. The other set of ideas I get are ideas just come to my mind when I'm in the seminar. It might be totally unrelated. And what I always recommend is getting a sheet of paper and just start writing. Just start writing ideas as they come down in your head. And that way you can focus a little bit better. And when you leave here, what I want you to do is have some real concrete outcomes of what you want to do. Just ideas you want to implement on the mat, ideas you want to implement in the community. And hopefully, if you're a martial arts school owner, some things that'll work in your school to make you more productive and make your business work better when you leave here. Okay, and the guys, that are on the call or are my moderators here, please interject anything if you want to. So first thing let's do, I want to thank our sponsors, Go To Karate and Martial Arts Wealth Mastery, and we've got some of these guys will be popping on. If you want some help on your online marketing for anything that you're doing, please take a moment. This is the reason we can do these for free. Go to gotokarate.com, write this down, /2019, and they can help you with anything you're doing online. If you want more students, this is really the place to go. Master Olson, you're using them, right? I think you're muted, so you're just not.
Yes, I am using them. Mm-hmm.
Yeah, absolutely. And you're using them for both projects that you're on, your martial arts school and Ask Master Moms. Can you tell them a little bit about the results you're getting?
Well, we're having, we started with the Go To Karate website the first of this year, and just have had really great success. I think I mentioned to you the other day, I can go back and show where half of the enrollments I've had for the year have directly correlated to our website that Go To Karate hosts and does for us. So that's pretty encouraging and exciting, and I'm sure that a lot of the other enrollments we've had and leads that we get, I know they're going to the website and looking at us first. So it's been very positive.
Yeah, you have like 450 students, and you're not in the world's biggest city. You're not in Manhattan. You're in Johnson City, Tennessee, which is a great city, but it's not a million people around either. So that's really successful.
Right.
And you actually, Martial Arts Wealth Mastery is another one of our sponsors. You're a member of that group too. I mean, really both. And I work with both of these companies, Martial Arts Wealth Mastery with Stephen Oliver's Martial Arts Wealth Mastery group. He's not here with us today. He was going to be one of our moderators, but he wasn't able to make it today. I would want to tell everybody, if you're not as successful as you want to be in your school, you really need to take some time and look. There's a lot of free resources, and all these guys will give you some stuff for free. So both of these sponsors have some free stuff. It's completely free. There's no real pitch or anything. Nothing's getting sold here. All this stuff that we're doing today is free, and there's some extra stuff that you can get. So everybody's really trying to help everybody else in the martial arts industry It's really the most ethical and beneficial things that groups of people that I work with and what we're doing today. So anyway, these are our sponsors, and you really ought to take advantage of the stuff that's getting used. So write that stuff down before we go on. So I just wanted to thank our sponsors. That's why we can do this stuff for free. So let's get started. Something about me, so you know kind of who you're talking about. I really won't spend a lot of time on this. This is some stuff about me. You probably, if you read some of the emails, this is kind of what I work on, or sorry, I went back too far. You know, you can read about this stuff later on the bio, and you can download it if you want. I won't really talk about it. If you want to read more, you can go to mastermoody.com. And there's some book references that I'll tell you at the end of the webinar, that all the books that I'll refer to, not written by me. I've written some, you can read those if you want, but the books that I'm going to refer to at the end of the webinar that'll help you with all the ADHD stuff that we're talking about, are on the Master Moody site. That's not a fancy site. In fact, Go To Karate didn't build that for me. They're kind of mad at me that they didn't do that. It's one that I just do. It's very simple. So it's not a marketing site. It's just where I put dump a bunch of information on to help you guys out. So there's a book club on there that has some information. And this is some of my background academically. So, you know, I'm not trying to brag. It's just so that you can get an idea of what I'm working on, some other stuff and interests that I have, and that's why we can hopefully help you with some things today. All right. Some of our moderators, Master Oliver, who's not here, but he's helped me a lot with this material. So he's, in fact, it's not Stephen Oliver, that's Grandmaster Jeff Smith. Let me introduce Grandmaster Jeff Smith. He's kind of helping for Master Oliver today. I want to introduce you to Grandmaster Smith, if that's a moment, then you can say something about yourself. Grandmaster Smith's a 10th degree black belt, 7-time world champion, but I think more importantly for today, he's run legendary Master Junior schools in Washington, D.C. area for many, many years. And of anybody, he's had more experience than all the people put together on this call in teaching and martial arts. So even though he's very famous for being a 7-time world champion, he's a mentor to me and hundreds and thousands really of instructors across the country in how to teach. So I'm really glad to have you here, Grandmaster Smith. I probably said too much, but you're a humble guy. Do you want to add anything to that?
No, other than my screen says Steve Oliver.
Oh, I know. I said that because I was going to tell him a little bit about Master Oliver before, and then you popped in exactly at the right time. Can you change your name to Grandmaster Smith so they remember you there?
Okay, I'll go do that. And I think you covered me good.
Okay, thank you, Grandmaster Smith.
If they want to know anything else, they can Google me.
Yeah, so there's a lot to Google on you, sir. Okay, Tracy Thomas is also one of the guys that he also wasn't able to be here today. You might have seen him. Also somebody that works with us with Go To Karate, and we're going to recommend some of his books. Let me introduce Master Olson. She's an 8th degree black belt, and we mentioned her a little bit already, owner of Olson's Martial Arts in Johnson City with 500 active students. We're going to recommend her book a little bit later. This is it. I was really excited to see it. We're going to recommend her book at the end of the webinar. So we'll talk about that a little bit. So you've got a really great crew here. She founded Ask Master Mom, which is outside of martial arts to work with parents and their kids. And it's a TV show. It's a media empire really that she's building right now. That's a website. You can go to askmastermom.com and see it right now. So really it's huge, and it's only started, what, 6 months ago, right?
Right, absolutely. It's taken off.
Do you want to add more onto that, or did I cover enough?
Well, it's been it's been really exciting. I think having the book completed and out has opened some doors for me. The TV show is fun, but I'm reaching people through podcasts and different other media means to reach people, and so it's been very, very exciting. And I'm hoping to help a lot of folks with the program.
Thank you, ma'am. And then Master Sanborn, I didn't put a slide here for her. I wasn't sure she was going to be able to be here for with us today. But Master Laura Sanborn runs my schools in Arizona. She's been with me for, geez, like almost 20 years now, right, ma'am? And she trains the staff and trains, oh, we lost Grandmaster Smith. She trains the staff and also runs all the KarateBuilt companies that we have. So thanks a lot, Master Sanborn. All these guys are so humble. They really don't talk about themselves so much. So I have to kind of talk about them, you know, for them, you know. Did you have anything to add, Master Sanborn? She just set up, I'll just give you an example of what she did just in the last couple of days. She set up something for me to teach a bullying prevention class to a whole bunch of teachers in the school. She did a meet the teacher night. We got like a bunch of appointments. So she's actively working with schools directly that turns into actual appointments. So this stuff it's real practical work that we can do that will turn into actual results in your martial arts school. So from whatever level you really want to work, this is going to be valuable information for you. All right, so let's get to it. And that's what I wanted to introduce everybody so you knew who we were working with. I'm talking real fast because we got a lot to cover. So we're going to work on understanding ADD and ADHD. And really what you're going to understand, it's one and the same. Learn strategies, well, not really one and the same, but the terminology you'll understand that what ADHD, to categorize it the right way. We're going to learn some strategies and tactics for working with the kids. I think what a lot of people want to have said in some of the other workshops that I've done is that's the meat that they want to know about. And we're going to spend a lot of time learning that meat today. That's going to be the main focus. So when you leave the webinar, you're going to have specific strategies so that you'll know how to work with the kids in your school. Now, that being said, the best way for us to train you is really do an 8-hour, we're not trying to sell an 8-hour workshop because I don't want to fly to your school necessarily and train you, but the best way to learn this is by repetition and training. So when you leave the webinar today, what you want to do and put this on your to-do list is take what we're teaching you and then go back and do lots and lots of instructor training on how to work with these kids. It's not about learning this stuff in your head, just like it wouldn't be about learning your martial arts techniques in your head and watching a video of it or watching me talk about it. It would be about maybe watching me talk about it, but then go practicing it a lot. So just like your martial arts techniques, what we're going to learn today, the practical stuff, should be about you going and then practicing it with your instructors if you have a staff, or practicing it as much as you can on your own. All right, so super fast history lesson about ADHD that you need to know, because I want you to be able to talk to people intelligently about it. If you're talking to a parent and you don't say the right things or you don't know the right things, then you're going to not sound intelligent. And it doesn't matter what level of education you have, whether you have a high school diploma or a Ph.D. or if you dropped out of high school. I don't care. I have a lot of good friends that didn't finish high school. It's totally fine. It doesn't matter what level of education you are. You guys are highly experienced martial arts instructors. You're educated people. I want you to sound intelligent about these topics. So ADHD versus ADD. In reality, history, this is important. It wasn't even a thing until 1968. A lot of you guys are older than you were born before 1968. I was. So in 1968, it was first called hyperkinetic. It was called being hyperkinetic. And in 1980, so that's pretty recent, it was called ADD. So that's where that term ADD came about. But in 94, everything became ADHD, and that's what it is right now. So the DSM-5, which is the current gold standard for all doctors or psychologists when they're dealing with kids, everything is called ADHD. So there really isn't any ADD anymore. You can say that term and people know it, but if you want to understand what doctors and professionals talk about, there's only ADHD. That's all that there is. And then it can be either combined, meaning they're hyperactive or impulsive and inattentive. So that's both, or it can just be inattentive, or it can be only hyperactive. So there's 3 categories. It's pretty obvious which ones there are. So there are some kids that are only hyperactive and they're not inattentive at all. So they attend just fine. Okay. So the problem with the ADD and ADHD, it didn't include this category here. Hopefully that makes sense to everybody. So that's the way it's classified professionally. So now you guys can understand that and talk. Sometimes you guys end up talking with teachers. We just did yesterday to a whole bunch of them. And the one that we were really trying to work with was the principal who had a Ph.D. in education. So we need to be able to talk, intelligently with her. So this is your fast history lesson. If there's questions, Master Sanborn, please let me know. You're the boss of the questions. So let me know if there's any questions that pop up about any of these. Please ask me if you've got some some questions. What you'll find is even teachers, sometimes even doctors, use these other terms. But you guys now know exactly how, you know more than sometimes a lot of teachers do in this kind of area. Okay, so why should we be concerned about this? And they're probably in your school. So this is controversial, how many? In 2013, it said, the DSM, American Psychiatric Association, said 5% of kids had ADHD. Now it's estimated that 9.4% of kids have ADHD. Well, it's like double. How did it double in only 3 years? Well, there's lots of different results. And now let's look at medication. It's estimated that 5.2% of kids are taking medication for ADHD. That means about half of the kids that have ADHD, that have diagnosis, are taking medication. That's a lot. Probably, I'll get to this later, but most of you guys, let's ask our panel here, would we guess that more kids than general, this is the general population, would we guess that more kids than the general population come to our school with ADHD? Like if 5%, if 9.4% or 5% of kids have ADHD, somewhere in that number, would we guess that more than 9.4% or 5% come to karate?
Oh, I would say that. A lot of them come because they know it helps.
Yeah. What would you say?
I think we get better at diagnosing than some of the doctors because we have such a comparison with a kid who can pick up how to pay attention, how to focus a little better, and the ones that are just off the wall and they're nowhere near the norm. And I'm sure that percentage now, because that was 2016, so 3 years later in 2019, we're probably at 20%.
I don't know. Yeah, 20% would be pretty high, but yeah, you may be right. It seems to be increasing. Well, it's partially increasing because of awareness, although we don't really know. But the interesting part here is, look at what percent of kids are taking medication. 5%, that's 1 in 20 kids are taking medication. You know the kind of medication they take for ADHD? This is pretty serious medication. These are medications that work on brain chemicals. So this isn't minor medication that these kids are taking. We lost somebody. Oh, we lost Master Sanborn there.
And we had some of those kids that were taking it, and by the time they've been in martial arts for a couple of years, the parents have been slowly reducing their dosage down to, by the time they get to brown or black belt, they're, you know, the parents have taken them completely off it, and the doctors are completely, amazed at that progress.
Well, that's a selling point for what we do in martial arts, and that's a good story that all of you guys should be able to tell, even if you haven't experienced that yourself, because you just heard it from Grandmaster Smith, and you can hear that from Master Olson, Master Sanborn, and myself. We've all 4 of us have seen that. If Master Thomas was here, he'd tell you the same story. So anybody with a larger school or more time has had many of those same experiences. What, in terms of medication, is probably a good time to talk about this, although I'm going to talk about it a little bit later. In terms of medication, we have to be careful about how we talk to parents about it. So I'm going to get to that a little bit later in more depth. But we do see that parents, if they're paying attention, sometimes parents don't pay attention to the medication. They just give the kid the medication or are happy that the kid's behaving now. But if parents are paying attention to the medication level that the kid is taking, then they start what doctors call titrating. If they titrate, that means change the level of the medication and lower it or raise it, or lower it or raise it, or change the type of medication that they're taking based on the behavior. In other words, they complain about it a lot. And they should be doing that, even though I don't encourage complaining in general in life. They should be complaining about these kind of medications a lot because there's a lot of side effects of these medications. But because this number is so high, it's not a big problem if it's appropriate medication. They should be taking it if it's appropriate. But they should also be very critical, maybe complaining is a worse word, but critical about the medication. If they are, then martial arts has a better effect, because now the parents, when they see better behavior, as Grandmaster Smith said, then they're going to start noticing and they can start taking their kid off the medication. But let's move on a little bit. So this is a chart of the diagnosis and how it's increasing. So you can see these are a bunch of different studies, but no matter what study they looked at, we see the diagnosis increasing. So a lot of people ask, well, why is the diagnosis increasing? A lot of times it's just awareness. Now there's a lot of, and we're going to look at causes of ADHD in a little bit. So the primary cause is thought to be genetic, and people are looking at other causes of what can happen. So brain injury if a kid has a brain injury, they can start exhibiting ADHD symptoms. And then some of these other issues. One thing, alcohol and tobacco does seem to have a relationship. So if people are pregnant, it's always good advice, right, not to be using alcohol or tobacco. There's one thing that seems to be common. Research doesn't support any of these things that cause ADHD. So it's really common to think, well, if I give my kid a lot of sugar, he's going to start acting up. There's been a lot of studies that have completely debunked that idea. Now, it doesn't mean that if you give your kid, now there's another idea, if you give your kid sugar and everybody thinks, it's called the Rosenthal effect, if everybody thinks that giving your kid sugar is going to make the kid hyper and the kid gets really excited about getting sugar, there's other reasons why the kid might get hyper, but giving your kid sugar or watching TV or any of these things here, these things do not cause ADHD. Those things might have other effects on your kid, but that doesn't cause ADHD. So all of those things as professionals. Now, one thing that we've even heard, I don't know if Master Olson, Master Smith have heard that, or Master Sanborn, that, well, if they do martial arts, they're going to get more agitated or they're going to fight. Obviously, we don't cause that either. I have heard that, though. Yeah. So, that's a silly assertion as well.
It's just the opposite.
Absolutely. Absolutely. But these things are also, that's a common thought, particularly the sugar one. And again, that's been debunked over and over again. Research gets done constantly in that case. All right. So let's move on from that. So let's see. So here's some symptoms. I'm not going to read all these because you guys probably know all these symptoms. We just got a lot to cover today. So there's a lot of things that that may be indicating inattention. Now, the only reason that later, if you want to watch the video, if the video comes out pretty good, we'll as usual, we'll share it. Sometimes I don't always guarantee that, so I appreciate everybody that came here. We don't always get 100% of people to show up that have registered. But if anybody wants this list later, you can also email me. I'll give you guys my email address afterwards. Some of these things you may not think of, though. If you see kids exhibiting any of these inattention type things, it can help you identify ADHD. It may not be something that we notice as much. Inattention isn't as noticeable sometimes as hyperactivity. Okay, so these aren't quite as big a deal sometimes as these things here. So hyperactivity, you're going to notice if the kid's not paying attention in your martial arts class.
And we've actually recommended parents have their children tested when we see somebody that exhibits those types of traits. And this thesis that you did on this was so helpful for martial arts school owners, because now it gave them something in written form to show a parent to say, because I will tell you, before, when I told a parent that, they got very offended because I really didn't have anything to back it up other than my own opinion.
Yes, sir.
And they asked me, well, if I want your opinion, I'll ask you for it, that kind of thing. So now this is, I hand them one of your papers and tell them, just something you might want to look into. We get a chance to see a lot of kids. And like you said, one of the reasons why the percentage is going up is because people are now aware of it, that there is actually such a thing. When a kid is acting in that behavior, it's not the norm. Whereas before they just thought it was, the terrible twos, or the crazy adolescents, how they're growing up and stuff like that, where in reality there's a hidden thing that is now being diagnosed more and more. So I wouldn't be surprised if it's 15% or so now.
Well, that's a good point, sir. And you know, to be fair for parents, if I'm a parent of one kid or two kids, I don't necessarily have any reference. You know, it's not like martial arts instructors. We see hundreds and hundreds of kids all the time. And parents don't see many kids. They see one or two, and they're not teachers. They don't see kids. So it's okay. And you're absolutely right. That's a good point. And we're gonna talk about how to deal with parents. And I think everybody's gonna really appreciate that in a second. These are some things probably most instructors notice really well. The inattentive stuff, these might be, let me go back. Yeah, these might be ones that some of you guys on the call may not notice as clearly. That these may be things that if you're talking to a parent and they're having problems, these might be things that you could ask. Are they having trouble with schoolwork? Are they having trouble organizing tasks? These are attention things, and it may be things that you're not noticing as well. And Grandmaster Smith's exactly right. If you have a list that's written down, then it's easier to then say to the parent, you know, there's something you might look at. If you say, yeah, your kid's got ADHD, you know, they'll give you a problem. And here's exactly what I wanted to talk about. So you're leading exactly into it. It's diagnosed by professionals. If you say to the parent, hey, your kid's messed up, he's got well, obviously you wouldn't say it like that. But if you say your kid's messed up, he's got ADHD, they could take offense at that. And you shouldn't do that because you're not a professional. I have my master's degree in counseling. I technically could diagnose somebody and get my manual out and do that. I would never do that. I would never do that because A, I'm not the guy who's going to prescribe the medication. I'm not the guy that's going to prescribe the other treatment plans. I'm the guy that's going to do martial arts training with them. So I'm going to refer them to a professional for that diagnosis. However, I'm part of the treatment. Martial arts is absolutely an essential part of the treatment. And so what we just need to do is understand it enough to help identify it. And then also I'm going to teach you some ways to deal with them better. So here's some things, though, so you can understand it and be really smart about this. For them to get diagnosed, when you send them out or before you might think about that, they have to, there's something called the Diagnostic and Statistical Manual. This is what doctors use or psychologists use. And they have to meet those criteria I just mentioned for inattention. So there's two things, inattention or hyperactivity. And they have to have 6 of those symptoms. And they have to have 6 of those symptoms for at least 6 months. So that's, if they're just doing it for a few months, there's something else going wrong, at least according to the diagnosis criteria. So they have to have 6 of those symptoms for 6 months. It's easy to remember them. So if they only have the inattention symptoms, then they're ADHD, only inattention, they're that inattention type. If they have both inattention and hyperactivity, then they're ADHD combined. And if they only have the hyperactivity symptoms, then they're ADHD, only the hyperactivity type. So there's those 3 types that you have. It also has to start before 12. Now there's adult hyperactivity, ADHD as well, and that has a little bit different diagnostic criteria. Okay, so that's kind of how it works. So just remember that they have to have 6 of those criteria, or just remember there's a bunch of criteria and they have to have a bunch of those symptoms, and they have to have it for a while. And that would diagnose it. If a kid's just acting up for a week, that doesn't mean they have ADHD and they need some other treatment. Okay, so that's really how you have to deal with it. Any questions, Master Samward? Do we have any questions on that? I saw a couple red spots pop up that are relevant that we should cover now.
Whether or not it's hereditary.
Oh, well, we already covered that a little bit, the causes. So the predominant cause is genetic. So that's hereditary. Genetic and hereditary are the same thing. But there's those other causes. It could be a brain injury. It could be caused, there's a little bit of evidence of brain injury. Well, brain injury can trigger ADHD. Alcohol and tobacco in pregnancy is a little bit of a factor in ADHD. It doesn't mean they're always going to have ADHD if you had one glass of wine when you're pregnant, but there's a little bit of an influence. So, you know, be careful about that stuff if you're pregnant. Those are some factors, but mainly it's genetic. That's the predominant reason kids would have ADHD. Doesn't mean don't have kids if you have a history of that, but that's what we would determine that is the primary thing. And genetic and hereditary are a little bit different as well, by the way. Okay, let's move on. And in adults, as I said, the symptomology is a little bit different. They just need 5 symptoms. It's pretty much the same example, but for some reason, the doctors say they only need 5 symptoms. So getting to what Grandmaster Smith said, this is really important for you guys. So parents, they can be really confused about it. The doctors, primary care physicians can be really confused. And I'm going to give my opinion here. This isn't a medical opinion. This is just Master Moody's opinion. I personally love it when parents that are dealing with kids with ADHD go to psychologists or psychiatrists, preferably psychiatrists, to have an evaluation. Very, very common that primary care physicians are the ones diagnosing and prescribing medications. I would love it if my students were taken to a psychiatrist for the final diagnosis and for any medication. I think they have more breadth of knowledge about these specific things, because doctors don't always get a lot of as much training as they could. So that's I'm going to give that my verbal suggestion. If anybody is one of the participants and they're a primary care physician, I apologize if that offends you a little bit. But I think that it would be great if they go to a psychiatrist, or psychologists can also help with the diagnosis. Obviously, they can't prescribe medication. But a psychiatrist is going to be able to have a little more breadth of new medications, and they have a little more experience in the specific childhood disorders like ADHD. So that's my rant a little bit on that. But certainly primary care physicians can do a really good job with the kids. The doctors can be confused about that. If you hear a doctor call the diagnosis ADD, again, I'm telling you, that's not the normal diagnosis for this stuff. Doesn't mean they don't know what they're doing. They just may use common terms. But anyway, parents can be confused. So here's some categories of parents. Master Olson, Master Smith, Master Sanborn, this is what I want you guys to talk about a little bit here. So here's how I categorize the parents. And I thought of this the other day, and I think we have 4 categories of parents in this situation. 1, my kid has ADHD, or my kid doesn't have ADHD, and then there's 3 statements of parents. The 1 is my kid has ADHD. The parent, this is the parent. The parent says my kid has ADHD. Category 1 is he really does. Then we're pretty much on the same page. Everybody can move forward. We can all, deal with the kid. We can ask them about their medication or not. We can do stuff. But then there's the parent that says my kid has ADHD, but the kid doesn't really have ADHD. You get some of those, don't you?
Yeah.
So we got to talk to them. Yeah, what do we do with them? What do you guys do with them? Master Olson, I haven't heard from you much yet. What would you do?
You just need to have a conversation with them, and like you were saying, be informed about what ADHD really is, and even be able to hand them something that says this is really what it is. So what I would get into, what are you experiencing with your child that makes you think that? And then have a conversation about those topics, and it could just be a behavioral thing, not having anything to do with a diagnosis.
Exactly. Yeah, that's a good answer. Master Smith, what would you say to that parent?
What I usually do, because I've actually had them ask me that, they said, I think my kid has ADHD. And I said, well, my opinion is based on how he's performing, he's right in the normal range of most of our kids. We are comparing him. He's only 4. We're comparing him against 6 years old. And I think he's doing fine. But here's a sheet that has these steps on it. If you think that he's showing any of these symptoms, I would suggest that you go get a professional evaluation. And that way, it puts me off, but it also reinforces my confidence in my decision based on the other kids in his age group. When we do our family class, we have a 3 to 6 year old group. We have a 7 to 12-year-old group. Sometimes it's parents who think because their kid's 4 years old and he's acting up a little bit, that's not normal, because they see other kids in the class behaving better. But a lot of those could be 6-year-olds. Mm-hmm. So I always tell the parents, I like to compare them against the other kids in their age group, because that way we can see what their development compares with. And to see if they're below average, above average, or right in the norm. And then I'll make that suggestion. I'll say he's better than most of our 4-year-olds, or I'll say he's as good as most of our 4-year-olds, or I'll say, well, he is a little under what our normal 4-year-old student is. So here's some of the symptoms if you think that he's exhibiting any of these at home, because as far as what he's doing here, I would not say that he has it. But if he's exhibiting things at home that fall in these categories, then I suggest that you go get a professional opinion. And that way it gives the parents the confidence. Sometimes they'll just say, well, no, I was just concerned because he was cutting up. And sometimes parents get embarrassed about their kids' behavior. And sometimes they're a little more critical than I am. Sometimes they're less critical. You know, you have those different type of parents.
Sure. No, I think you gave a very complete answer. I love what you said. And Master Olson, you had, I mean, both of you said some really good things there. Sometimes they're identifying the wrong thing as ADHD, and that's kind of what Master Olson, you were talking about. And sometimes, but what Master Smith said is you've got the out of saying, here's some information about that, and then you can get a professional opinion. But here's the reasons why. What your kid is doing is about what we'd expect. And you've got to understand what I said before. Parents don't have a lot of references like you guys do. And some of our people on the call here, you might be in your 20s, and not that being in your 20s doesn't mean you're not really, really smart and experienced. In fact, what I would say is the opposite. You can be in your 20s and have been teaching for quite a few years, and you know more about kids because you've had more experience with kids than most teachers that have been teaching for 10 years because you've been dealing with them for maybe since you were 15 or 16. So you can identify, you know that a kid might be more hyper, have some more of these symptoms than another kid. And like Master Smith is saying, you might know that, hey, that 4-year-old's pretty normal, when a parent would come to you and say, hey, I think my kid's got some issues. So have some confidence in your abilities to identify when there's a kid that's got an outlying problem and when there's a kid that's not. Most of you on the call can identify, hey, something's wrong, or they're doing pretty good. And that's a really good point. Master Sanborn, did you have anything else to add on that one?
Yeah, so the only thing I would do is that if a parent really feels that their kid has ADHD, whether we agree with them or not, is strongly encourage them to get that professional opinion and a professional diagnosis, because there are, I'm losing the word, there are supports and things that they can, help that they can get for their kid, and the earlier they get them, the better they are. So they can get support through school systems and things like that, that if the kid actually does have ADHD, whether we agree or not, the parent can get help and support from the school systems and the state and everything else if their kid has that diagnosis. But if they just think they have it and never do anything, they don't get that help.
Yeah, that's a good point. What if they are expressing that, and the kid does have ADHD, they need to take action. They can't just say, well, we're going to deal with it at home or whatever. They need to take some action, because especially in these other cases that we'll talk about, this is really important here in these cases that they do take some action, because there is a lot of support and there's a lot of things that they maybe need to do. Yeah, that's a good point. The only other thing I'd add to what you guys are saying is sometimes the parents in any of these cases might be saying, well, my kid has ADHD, so he can't do karate. That's the question that I want to make sure we all on the call are very clear at. You need to turn that around to, your kid has ADHD, so therefore they must do martial arts. We've all got to make sure that gets turned around immediately. My kid has ADHD, what may happen is, so therefore I don't think they can really handle this. No, your kid, is having some issues. That's why they exactly have got to be here. And if you don't have them here now, think about what it's going to happen if they continue along this path. What's the consequence of them not having discipline, and what's the consequence of them not doing this? So they must be here. And you've got to be firm on that and be confident when you say that. And that's not, hey, look, we want to keep the students. I grant that we want that from a business point of view, but you want that truly to help these kids as well, because it will make a difference, as we've all said. But let's talk about these other two cases real quick. So the other one that we get is my kid, let me erase these. So my kid doesn't have ADHD. My kid doesn't have ADHD, but he really does. And this is sometimes the trickier one that Grandmaster Smith talked about a little bit. The kid's all over the place. The kid's going nuts, or he's really inattentive, or he's got problems. You've identified this, and you're a professional, and you see hundreds of kids all the time, but the parents think nothing's wrong. So this is one that's tricky to address. So one of you guys, yeah, go ahead.
I have a suggestion for that one. You know, if you see the kid is just unable to handle a classroom situation, they want to touch everything, they're not following any of the rules, and the parents just, sometimes kids are just be kids, they're active, but you recognize that something's a little off. Just have a sit down time to talk about when you're doing the progress checks and say, so how is his behavior in other places? You know, how is the child's behavior at school or in other social settings, things like that, and try to find some more information. And then you can talk about, well, while he's here, I would really like him to be able to, and then whatever that is for you, you know, stand still, follow directions, you know, not touch the other kids, you know, whatever it is that you're having trouble with, and say, that's what we're going to work on here. Is there something I can help you with outside of here that you're working on? And so you open up this conversation and get them to realize, you know, kind of get out of that tunnel vision and see that my kid is having trouble in other areas too. And they start to open up and trust you. And then that might build into that being able to present, here are some things that you might want to look for. You know, I've worked with a lot of kids. Here's some list of things that kids with ADHD show. You know, are any of these something that you're concerned about?
Absolutely. That's a really good point. And in almost all cases, they will identify a lot of other areas that frustrate them about their kids' behavior. In almost all cases. I had a few that say, no, they're well behaved in everything else. What would you do with them, guys?
I would just say, well, here's the rules here, and this is what we're going to work towards complying to our rules.
Okay.
I hope you have their agreement.
Right, and then you got to get agreement there. That's a good point. That's what we need to do, because you do need to have high standards in your school. We're going to get to that in a little bit.
Yeah, what I tell them is what they need to do is develop self-discipline, and that's what martial arts teaches them. Because a child that is self-disciplined can accept someone else's discipline, and until a child is self-disciplined, he cannot accept someone else's discipline. And I'll tell you one other thing about the diagnosing a child behavior. It is actually much harder for us than a school teacher. And the reason for that is not that either one of us is educated more than the other, but when a school teacher, she has all fourth graders. So it's all the same age group. So somebody who's not the norm stands out a little bit more. You know, when we're in martial arts, you know, we have kids from 4 years old to 70 years old. Adults and kids mix sometimes. And so it's hard to judge whether their behavior is more a norm for their age group or not, whereas if they're in a school program, it's a lot easier. But I do address, especially when a parent tells me that, well, they don't, you know, they do everything fine at home. And then I say, okay, well, remember, martial arts is to teach them to develop this self-discipline in 3 areas: at their martial arts school, at home, and at school, their academic school. So if they're doing it at home and they're already doing it at academic school, then let's just get them doing it here, because all they have to do here is learn the 4 laws of concentration. And so now we're re-interjecting our martial arts benefits to them and how we can train them that will help them in other things too.
Right, and so that's how to generate buy-in for what we're doing. Most of the time, what Master Olson's saying, I think, is right. They're going to tell you, oh yeah, they're having problems everywhere else, and that's why they brought him in. In the anomalous case where they brought him in, and when we asked them what they wanted out of martial arts was, I don't know, they wanted to learn, you know, self-defense and the kid's all over the place and it's obvious the kid needs discipline, you know, you may have to be re-injecting that that's really what they need to learn. You've got a kind of a clueless parent there, and we've got to really get them shifted into what's right. So that can be more of a challenge. And having the criteria, understanding the criteria that we mentioned before is helpful. Master Sanborn, did you have anything else to add there? Nope, they kind of covered everything. The last one that we may need to think about, and I think this one's a little bit easier, is parent that really doesn't know anything. They haven't paid attention. They, like, you know, have you noticed your kid's behavior? And they're like, oh no, I don't know anything. I think maybe there's something going on with your kid and he's a little bit more hyperactive than the other kids, or he's not behaving as well as the other kids. And you have to initiate the conversation, and they haven't even noticed that. This one can kind of get initiated because the parent might even say to you, hey, my kid's not behaving in class. What's wrong? Why aren't you guys correcting them? That could be the initiation of that conversation. In this case, they may not even know anything, but you've got to have a conversation with them because the kid's all over the place. So I think the conversations, and you guys can tell me if you agree or not, I think these conversations are similar, except I think this one can be a little bit easier a lot of times because they're just not paying attention. But what would you guys add anything to the parent that they didn't even pay attention, they didn't even know that there was a problem?
I think sometimes it can be an easier conversation, you know, because you can bring it to their attention, and you know, especially if you've got a preschooler, they haven't gone to kindergarten or first grade yet. You can say, hey, we're going to try and prepare them for school. These are some things they're going to need to be able to do in school. So you can kind of bring it to their attention that way. But if they're, you know, on the other side, if they say that their kid doesn't have ADHD and, you know, you're trying to help with the behavior, but they're refusing to commit to that, that can sometimes be a little bit harder too.
Yeah, that's more case 3. I'm thinking of case 4 where they don't even notice anything, and you're the first person that's ever told them that their kids have an unusual behavior. See, I think that does happen sometimes.
Absolutely, absolutely.
Yeah, I think that conversation sometimes is a little easier, but you need the same skills. So we've talked about some really good skills, and again, please guys, add anything you want to, if you think of a certain scenario. What we need to be able to have is the skills to be able to talk to a parent as early as possible at white belt when they're brand new, or whatever your first rank is for anybody on the call. As soon as they're brand new, to talk to them about the situation so that we can all be on the same page. They may need a referral to a specialist, a doctor or psychiatrist, so that maybe they do need to be on medication, even though I don't really want to contribute to adding medication to the mix if they don't need it. But if they do need it, for anybody who's ever had a kid that really did need medication and they got medication to the kid, everybody's life is better. For anybody who got medication that they didn't need medication, that can be very traumatic, and it can be problematic, and there can be weight loss issues or weight gain issues, and there can be mood issues, and there's a lot of side effects of medication. So I'm not a big proponent of medication for its own sake, but if they need medication, it can certainly, you know, change the life of the kid in a very positive way if that's the right thing to do. Certainly, there's other therapies that the kid can have as well that complement them, and it can help them in their martial arts training, help them at school. So the doctor can be a really good asset to the parent if it needs to be that way. And you guys can change the parent's life if that's the proper referral. And that's not the only thing we're talking about. It might be what we're going to follow up with in the rest of the training here today is going to be ways you can support the parent. There might be other things. If the parent's just aware of the problem, then they might be completely relieved. In these cases here, or even in this case, oh, now I know what's going on with my kid. Because now, if they know what's going on with their kid, they can go, oh, I see. And then they can take some action if they're aware of what's happening. Okay, anything else to add before we go on? Nope, let's go. So if you need help in a particular case, I've had some people afterwards email me and say, hey, I've got this person or I got this situation. Please just email me. Everybody write this down. There's my email address. So I'll give you guys a second to write that down. You probably got it in a bunch of emails anyway. You can email me and make sure you include your cell number, not a work number, because I'll probably text you if you want to connect with me. about any of these topics. So anybody on the call has access for that. All right, so now we're moving. So implications for instructors. So let's talk about how we're going to do something about this. And we're going to try to get through this pretty quickly. So we're going to discuss a few curriculum things that we need to cover, and then we're gonna spend a very short amount of time on this, a few curriculum and instruction things, and again, getting feedback from our moderators as possible. And then we're going to review a critical discipline system. This is my favorite part of this, that I'm going to show you a discipline system that'll work for ADHD kids, but it'll really be a system that works for everybody. Our goal would be, I don't want to have, if you took the autism workshop or the bullying prevention workshop, I don't want to have systems for kids with ADHD that are different from everybody else. That we got 15 different systems in the school. I don't want that. I just want one system that works for everybody. So I want to have systems that we have in place that are good enough that it'll work for all of our kids, and they're just so good that if a kid's got attention issues, they're going to work for him or her. So that's what we want to have. So I'm going to talk about a few curriculum and instruction issues that a lot of you guys may already do, so we'll go quick through those. And then we're going to talk about a discipline system that I really fell in love with and we adapted for martial arts that I think is going to help you guys out a lot. If you're not using it, you probably aren't. So I think it's going to make a big difference in your school and your life. All right, so I'm really excited about it. It's going to help all the kids on the mat. It's going to help parents at home. It's something you can help them with and they can use, so you're going to have value and it's going to help you with retention. It can even help the systems that you have in the school, and it'll help keep your instructors sane, because now they can work with any of your kids with attention issues, with your little dragons, tiny tigers, the little preschool kids, which by the way is the next webinar we're going to do, which I think is going to be huge, on 3 to 6 year olds, how to work with them, and then it'll help you with your business. All right. So curriculum stuff, I'm going to go through this quickly. Just as a criteria, and this number is really low. We try to test 95% of our active count. That doesn't mean we let everybody test. We're not a belt factory. Nobody here on this call is that way. We have really high standards for our testing. But we want to make sure that in a testing cycle, our curriculum is enough that is simple, not simple enough because it's easy, but there's enough curriculum that all of our students can get through it within a testing cycle. So the point of this first bullet is some martial arts schools have way too much stuff they try to teach within a testing cycle. If you've got a kid with attention issues and you're trying to cram way too much stuff in a testing cycle, and only 50%, so just like use this number as a message. If 50% of your students are only making it through a testing cycle and getting all your material down, you probably are teaching way too much in a testing cycle. Make them take longer to get their black belt. Make them take longer to get their, whatever belt you want to get them to. Take longer to get stuff. Just chop your material up into smaller pieces. I'm not saying water anything down. We don't water anything down. It takes longer in our school than in our colleague schools to get the next belt and in our black belts. But so it's hard. We make it hard on the students, but you've got to make sure that within a 2-month or 3-month or however you test, it's the normal person can get the material down. Because if they've got attention issues, it makes it harder for them. So in a normal bell curve, these guys are towards the bottom in terms of ability to absorb material. You're going to have more trouble with them. Therefore, they're going to be attending worse. Therefore, you're going to have more issues. So that's one issue. That's one curriculum issue. And the way I'd measure that is if you're under 70% of your students getting through testing stuff within whatever your testing cycle is, that's an indicator. Some of the people that are having attention issues, maybe they need to get bumped down when they first start into one of your preschool age classes. We don't determine the tiny tiger little dragon classes on age completely. Somebody might be 7 and they're having attention issues. We don't make it a negative for them if they need to start out in the younger kids class. Doesn't matter for us. Maybe there's a special needs kid, maybe whatever. They can start out in the younger kids class. They won't feel bad ever being in that class. So that might be a way for them to start so that class has a little bit more pacing. It paces different and they learn the curriculum a little bit slower. So it's a little bit easier for them to adapt. They might also be more suited in terms of curriculum to private lessons for a little while so they can get up to speed. So that might be in addition to or instead of regular classes. So this is a way to deal with ADHD. Again, I'm going to go quick through this because this is the most important thing for today. Again, you guys pop in if you want to add anything to this for our moderators. Nothing? Okay. Just pop in.
That all sounds great.
Okay. So instructionally, I'm just adding a few extra things. Reward systems need to be part of your program. You need to have we use stars and we use stripes as part of the reward system. With ADHD, you need to make sure that when they do something right or when they're doing something wrong, that there needs to be some sort of correction or reinforcement right away. And we'll talk about that a little more in the discipline system. But there needs to be a reward system in place. The Martial Arts Wealth Group, again, if you use some of the tools and go to that website, martialartswealth.com, and you hear Grandmaster Smith talk about it, he's like the world's expert in reward systems if you get to take some of the classes and things with him. But rewards need to be used. So if you don't have a reward system, or if you somehow think, well, no, they don't need rewards, or I'm just verbally rewarding them, that's not going to work. And it won't work very well with those kids. Most of the time, these kids get punished a lot more, or you call it consequences, whatever you want to call it. They get punished a lot more. We have to be able to control their behavior on the other side of the equation. And we'll talk about that a little more in the discipline system. So you need to have a reward system in place. These are what we use, as well as other stripes. Master Smith, we're using your system too. But we use additional reward systems as we're doing all the different systems that there's a lot of reward systems built in place in our regular curriculum. That's in our regular curriculum. So the ADHD kids get a lot of that as well. Kids with autism do too. Okay, pacing classes. Your normal classes, again, I don't want it to be the same for everybody. Your normal classes should be paced so that nobody's standing around. I've seen a lot of martial arts schools where they're doing, let's say, a martial arts form, if that's the type of style you have. And they'll say, okay, do move 1. And then the instructor walks around and corrects everybody. Then they do move 2, and the martial arts instructor walks around and corrects everybody. I don't know about you, but that's pretty boring to me. But that may be what you like to do. And I'm sorry if I offend anybody on the call, but that's not going to work for these kids. I mean, if they have to stand around for more than a few seconds, it's boring. Besides that, it doesn't give students a lot of repetition. So that's not a good way to teach classes. Again, I apologize if that offends anybody. So pacing a class is really important. It doesn't matter if they have ADHD or not. I'm going to get fidgety if that happens. So pacing of classes is really important. So that's a basic instructional technique. Again, guys, add on to that or stop me if you want to add anything. Visual tools are really important in instructional class as well. Everybody on the call that I've seen has a lot of visual tools. There's pads, there's other things that students can look at. We need to control what students look at in class. By the way, same for adults. If everybody can look at a bunch of different stuff while they're in class, it's going to be hard for a kid with ADHD to pay attention. That's why teachers have trouble in class. Classes are very high stimulus. And if teachers when they're teaching kids with ADHD, they have to make sure that the noise, the sound, and the audio are all right in the front of the class. Otherwise, the ADHD kid doesn't know where to look. If they don't know where to look, they're going to look at random places. The more attention issues they have, the more places they're going to look, right? So you guys have to understand that as well. Again, I'm going quick through these because I want to get to the other place. Educating the parents. So this is a standard thing we do for everybody. If there's kids with special needs, if there's kids with any kind of other issues, we make sure the parents are educated to know your kid might be a superstar and be kicking to the ceiling, and this other kid might be kicking this high. We're not giving one kid a higher belt because they kicked higher and another kid a different belt because they kicked lower. That's not what the school's about. So the culture of the school, if it's about you're performing higher or you win a trophy at a tournament so you get a different belt level, then that's going to be problematic, and the parents need to be educated to understand the performance is based on their improvement, not based on, like physical ability or talent. And so this is true whether, to be able to manage the school with special needs, be able to manage the school with kids with attention issues. Doesn't mean we're easy on them. It just means parents need to make sure that we need to have the right culture with the parents. Maybe you guys could add something onto that, Master Olson or Master Sam.
I think that, especially educating the parents on how you teach as an instructor. For instance, at our school, we use positive reinforcement quite a bit, since as opposed to negative reinforcement. And parents are always amazed at how well that works, because they're used to a lot of times just telling their kids, no, stop that. And if they can turn that around mentally to start looking for the things they're doing right and reward things that they're doing well, they're going to see a lot better behavior at home too. And so all of a sudden they realize that what you're doing on the mat is helping them be a better parent, is helping their child focus better. Especially you mentioned in having the right targets and things for the kids to focus on. That's huge for anybody who's struggling with attention issues, is to have that one thing to focus on, and that can really help. It can also be something that you could educate your parents on. If you're trying to help your kids do their homework, take away all the stimulus and give them just the one thing to focus on. So absolutely educate the parents.
Thank you. Yeah, and the parents don't know when they do a martial arts. I mean, they may have seen Karate Kid and they may expect us to be the bad Karate Kid school. They wouldn't be surprised if we yelled at their kid, and they
Right.
wouldn't be surprised if we made them do knuckle push-ups in the rocks. They wouldn't be surprised at that. They may not like it and they may quit if we did. They probably quit if we did that, but they wouldn't be surprised if we were that way, if you think about it. So the fact that there may be a kid that's fidgety in class, and there's a kid that's listening really well, and the kid that's fidgety kind of gets through the class and they earn their next belt, and the other kid does too, and that's their kid, and they go, well, why is my kid getting the same belt as that kid? And somehow you got to make sure the culture's right so that that's all okay. The same with the special needs kid. Now, I'm not saying if the kid's not doing well and he's a bad attitude, maybe they don't promote. That would be okay. So nobody's saying be easy on everybody. That's not what we should do. In fact, we should have really high standards, but make sure the cultures, everybody understands the culture. So the other part here is, now this is the most important part for today. This is the most important part. So everybody that's stuck with us, and I think we've had pretty good attendance throughout this call for our participants. It's been a pretty steady number. This is the most important part of the call. It's really the ultimate class in discipline on the mat. And this is one of my favorite things to teach. So everybody stick with us for this next part. And it's really applicable not just to the mat, but everything else we do in our could be in our lives. I've taught this class to a whole bunch of people in a medical company, and it applies to what you're doing in other business, because it's really basic behavioral psychology. And most of the time we don't learn this when we're learning to be black belts, we're learning to be instructors. So really quick, the discipline system that we're going to have, rule number one is that we're going to have really high expectations and standards for the students. So these kids have ADHD. I don't care. I still want them to stand still. They have ADHD. I don't care. I still want them to do the stuff that I tell them. But what we're going to do here is, and I don't care if they have autism. I don't care if they have Down syndrome. I don't care if they have one leg. I don't care. I mean, if they have no legs, I don't want them to stand. I mean, you know what I mean. That's a bad joke. But it doesn't matter what's going on. They should still have. We have high expectations for them. So we still want them to do everything. Now, are they going to do it perfect the first day? No. But my expectation is very, very high. So what will mess everything up is if we ever as instructors decide they have this issue, so I'm going to accept worse behavior. Now, we're going to drive ourselves nuts also if we expect perfect behavior all the time. But there's the balance of we still keep an expectation of very, very high expectation for excellent behavior. So that's critical. They need to do whatever we decide. So what we're going to talk about is we first have to make sure we're really, really clear on what the behavior is. And the secret is, if you have a much higher expectation, if your behavior expectation is higher, then it's easier to keep the class disciplined. That's the most important part. If the expectation is higher, then it's easier to keep the class disciplined. Okay, and it's also more fun. It's more fun for the students, it's more fun for the teachers, it's more fun for everybody in the system. So really quick, this is a 1-minute behavioral psychology class. You got to understand the difference between classical conditioning. This is like you're training your dog. There's an event, this was Pavlov. You've heard the word, everybody's probably heard of Pavlov. There's unconditioned and conditioned stimulus. There's an event like there's food, the dog salivating, his mouth waters, and then there's a bell when that happens. That's the unconditioned stimulus. And then you start ringing a bell, and then the dog salivates. So that's a conditioned and unconditioned stimulus. That's classical conditioning. That's not what we do. What we do is what B.F. Skinner kind of came up with, which is operant conditioning. Positive and negative reinforcement and positive and negative punishment. Or in the modern world, we call punishment consequence because it sounds better. But in real world, in the original idea, it was called punishment. And then the only other tool is extinction. Really, this is what we do. This is what you guys do. You have positive and negative reinforcement. Reinforcement means increased behavior. Punishment means decreased behavior. So when you say, stop doing that, that's a punishment. That's stopping behavior. Anything you say that stops behavior is anything that removes behavior is a punishment. Anything that increases behavior is a reinforcement. That's the basics of behavioral psychology. So that doesn't mean that punishment's bad. It's not inherently bad. And if we think it's bad, then we stop doing things that might be good. Extinction essentially means ignore. So if you stop reinforcing or stop punishing or stop doing something, things will stop happening. So this is important because sometimes parents unknowingly, or us unknowingly, do stuff, react to things that kids do, and that keeps them doing things. And if we stop reacting, then they stop behaving a certain way. So that's extinction. And that's it. There's only 5 tools that we actually use. And everything we do is one of these tools. And we have to understand these a little bit. And they're actually kind of a little complicated to figure out. They're a little complex if you read them because they sound, negative reinforcement sounds like you're doing something bad. It's not. You've got to read up on what these things are. This sounds like you're hitting people or something, and it's not. These are just how you, positive means I add stuff to increase behavior. Negative means I remove things to increase behavior. Like a negative reinforcement would be like a threat. So you're worried about something, so I do stuff. I'm worried about getting in trouble, so I clean my room. That'd be a negative reinforcement. So this is a little bit complicated. So I don't want to spend time on this, but this is what we do if you want to read up on it. That's the 5-minute psychology, or 1 minute, I think it was more than a minute psychology class. This is what we do. So we're going to make sure that discipline in any environment, you've got to be able to use these tools correctly. So to do this, it's only 2 steps. This is what all of you guys need to do. Everybody needs to do. We do this actually on a regular basis and refresh it. The first thing you have to do, and most of us don't do this, is clearly define exactly what behavior we expect. And then the second thing is I'm going to show you the techniques to reinforce the behavior, to get the behavior to happen. And it's very simple to do. It's not going to take us long. It's going to take you a while to practice it. So I'm going to show you how, and then you're going to have to practice it. So what do you do? What's the specific behaviors you want in your school? And you need to define the behaviors the students have, how they should stand, how they should get on the mat and on the mat. So before they get on the mat, we define how they walk in, how they bow when they walk in, where they put their bags, how they get their cards, where they put their shoes, exactly where everything. Master Olson was just at my school. So you saw where the shoes go, where the cards go, where everything goes, where they bow when they walk in, and all the students know exactly where to go so that everything's organized. And what they do on the mat, where you didn't get to see the whole thing because you were only there for a little bit, but everything's exactly the way it's supposed to be. We have to write this down. You didn't get to see the wall, but there's a poster on the wall, how we talk about how the parents act, we define, how the instructors act. You saw the there's a parent waiting area rules, right, Master Olson?
Right,
So
right.
there's a poster that says how the parents are supposed to act. They can't use their cell phone when they're waiting. They're supposed to be quiet unless we ask them to respond. They're supposed to do, like, there's 8 or 9 things they're supposed to do. Okay, so we wrote those down for them so they knew, and then we reinforce it. The instructors have rules. The instructors are supposed to call certain things by their name. They have a name for the starting position of their hands. They have a name for the ending position of all their hand techniques. They have a name for the execution way, the way they're supposed to say it. They don't say different words for this position. They don't say different words for this position. They only have one word. So that way nobody gets confused. It's exactly specific. Why do we care? Why are we so crazy about that? Because if we have 4 words for it, then people get more confused. It makes it simpler. So we have very specific behaviors we define. If you have specific behaviors, then it's simpler in the long run because they don't get confused about how they're supposed to act, what they're supposed to say. The more specific you get, the more disciplined they can be. So also what the staff is supposed to do, what they're supposed to wear when they come in, how they're supposed to dress. This is actually what they're supposed to wear. They're supposed to wear this polo shirt. Master Sanborn, do you have that shirt on? You better. Okay, so she's got the same shirt on, even though she's calling from her house in her office or her house. So she's wearing the exact right shirt. I didn't have to tell her because we've already defined that behavior. So the way you do that, and let's just show you how that would work quick. And again, if the entire school doesn't know exactly what the behaviors are, it makes it a lot more complicated. It's a lot harder. Now, it's a little bit of work up front. You got to define these behaviors. And you might think you have defined them, but I would challenge you. Do they know exactly where, when they walk in, where they're supposed to sit? Do they know exactly where, if you have a tracking card, where it's supposed to go? Do they know exactly what they're supposed to say when they walk in? Do they know exactly everything? And whenever I go to a school, a lot of times people say, oh yeah, they know that. And then I watch and I go, well, wait a minute, those 2 people did it differently. And then I go, but those 2 people did it differently. But that guy did it different from that guy. And then I watch the instructors teach. And the instructors, when they do this move, they said one thing. And when they did this beginning position, they said a different thing. And when they said this, and guess what the students don't know? They don't know what they're supposed to say. And then when the students become instructors, the students in my school, it's really easy because the students have been hearing that since they were a beginner, exactly the same words. So now when they teach it exactly the same way. So in my world, it's very easy. It's very simple. I don't have to train people again and again and again. So this is, if you can absorb this first rule, you don't have to do all of it, but just do a little bit of it. The first job is define exactly the what. What's the what? So for students, so you might say, just for now, students, how they should stand, how they should sit. We have a specific way they sit. They sit with their hands crossed like this, and we call that sitting like a black belt. And I would define all these, and there might be only 20 things. And we have a command position. We say set. I learned that from Grandmaster Bill Clark. And that's the command we use for that. And then we have all kinds of positions and what they're supposed to do. So we just write those down. Now, I don't implement these all at once. We just implement one at a time and make sure that all the instructors know how to do it. So first part of discipline, and you may have this all defined. If you do, that's great. First part of the discipline system, and again, this is for ADHD to work, but it's going to be applicable to your whole school, is that everything is written down very specifically. If you have a jiu-jitsu school and a taekwondo school in the same school, I would try to use exactly the same commands. So one's Japanese, or maybe it's Brazilian, it depends on your system, and one's Korean. I would then maybe use English for the same commands. That would just be a suggestion, might be an idea. But then have the same, as much as you can, have the same exact command. So it just makes your life easier. So that's the way you would start. Now, once those behaviors are defined, here's the more important part, because that's pretty easy, defining the behaviors. You guys probably already know that. Now I'm going to show you how to make sure those behaviors happen. And this is probably the most important thing you could learn in teaching and instruction. Now we're going to talk about how to make sure the target, we call those target behaviors, make sure those target, imagine this is a bullseye, the target behaviors happen. So we have three kinds of behaviors. We have target behaviors, we have behaviors that are a little bit off target. They're just a little, they're somewhat off. And then we have what we call count or consequence behaviors. Okay, these are ones that are so bad, they're off target, they're not doing it right, that we have to stop the behavior immediately. Somebody punched somebody in class, or somebody pushed them hard. Now, we wouldn't get generally somebody punching somebody, but somebody pushed somebody in class. Somebody yelled at somebody, called them a bad name. Obviously, that would be a consequence behavior. But somebody consistently doing something wrong, somebody doing consistently wrong ends up being consequence behavior. So let me teach you how this would work. So I'm just going to draw it out here. So let's say we have three behaviors. We have target behavior, we have off-target behavior, and then we have, and everybody should be taking notes, count behavior. We're going to call this count. Oh, C-O-U, oops. C-O-U-N-T, count behavior. So this is when there's a consequence. So first I want to address off-target behavior, because this is what almost all instructors live in. Everybody lives in this space. They don't live in the other two spaces, and I'm going to explain why. This is when a kid is not standing quite right. They're not kicking quite right. They're not doing something quite right. Or an adult not doing something right. And then you usually correct. You correct their behavior. You say, stop doing that, or do it this way, or do something else. Maybe you even use the old PCP, praise, correct, praise, which I don't believe in. I'm going to tell you right now, I do not believe in praise, correct, praise. Praise, correct, praise is confusing. It's confusing to the person. They got praised, then you said, yeah, but do it right. And now they did it right, and then you corrected them. I believe in correct praise, but not praise, correct, praise. So correct it, and then did it right. Okay, that's right. You did a good job. You fixed it. Correct praise is the right way to do it. That's a longer story. But correcting is fine. This is fine. This is good behavior for an instructor. Somebody did something wrong, you correct them. Somebody did something wrong, correct them. That's fine. The other thing that I think everybody does really well, all the instructors on the call here probably do really well, is you do praise others. So in other words, kids not standing right, kids doing something wrong, you tell the other kid next to them or a kid in the class, hey, you're doing a really great job standing at attention. What happens? The kid that's not doing it right stands at attention. So you guys are all pretty good at this, I bet, and you're probably pretty good at this. Kids not doing it right, you correct them, or kids not doing it right, you correct the other kid. Almost all of you, I bet, are really, really good at this. And for most behaviors that aren't right, that corrects them. Master Olson, would you agree on that?
Yes, I would absolutely agree on that.
Everybody's really good at that. Now, here's what doesn't happen. This one. Well, I'm sorry, let me go back. I'm gonna address counting behaviors first. So this is what people do a lot of. They do a lot of correction, and they get people to get back to target behavior. So they correct them, and then they go back to target behavior. They go back to fixing it. They're doing it right. Now, what count behavior means, and it's from the book 1, 2, 3 Magic, and I'm gonna, this is one of the best books you could ever buy. I'm gonna give you the reference for it. And all we do, if they're really doing it a lot, so either it's severe, they're doing something really wrong, we have to stop the behavior. So this is a behavior we have to stop immediately, or it's been happening enough. They're not standing right for like a long time. They're basically just ignoring the correction. They're ignoring the correction. And now we have to stop the behavior, is we use counting. And it may seem a little juvenile, but it's very effective. And what we want to get to the point of is when we count, all we have to do is put one finger up and then the behavior is corrected. Because at some point you need to have a consequence. Let me use the example. If all you do ever when there's bad behavior is correct, if I'm a student, all I would ever have to do is ignore you. I could be rude and I could just ignore you. Yeah, so whatever. I'm just going to stand this way anyway. I could just ignore you. So what's the final outcome? Eventually, there has to be a consequence. Eventually, if I'm speeding in my car enough, somebody's going to have to give me a ticket. If all I ever got was a warning, believe me, in my car, you saw my car master rolls. In my car, I'd be going 100 miles an hour every day. There has to be a consequence. Otherwise, I'm going 100 miles an hour every day. So there has to be a consequence. So what's the consequence? The consequence is going to be sitting out of class for the number of minutes equal to their age. They're 3, they sit out 3 minutes. 5, they sit out 5 minutes. 6, they sit out 6 minutes. For the younger kids, we just have them sit with their parents, and we train the parents to not talk to them. We just say they've got to sit out with you. They don't get to participate. We don't get mad. We don't tell them why. They already know why, because they've been corrected before. We don't tell them, and I'll come back to that, but the consequence is you sit out for the number of minutes equal to your age. We don't negotiate. We don't tell them. They just sit out. So the way it goes down is this. The count is, that's 1, that's 2, that's 3. We wait between each of the counts. At 3, okay, sit out with your parents for 3 minutes, whatever number of years they are, however old they are. They're 5, that's 5 minutes. And they just sit out. If they're old enough, they just sit on the floor, on the side of the floor. That's it. That's the consequence. Okay, let me explain the consequence again, because I want to be really clear about this. What I see a lot of instructors do when they do this is they say, that's 1. If you don't correct it, I'm going to go to 2. That's absolutely the worst possible thing you could do. You should never, ever do that. Once you initiate a count, and this is why people don't use this system, by the way. They say it doesn't work. That's because they don't do it right. Once you initiate the count, you say, that's 1. And once you start that, it's like a countdown to an explosion. It just goes. Either the behavior gets corrected or they go to the consequence. There's never any other negotiation. There's never any other statement. There's never anything. So you say, that's 1, that's 2. Either the behavior's corrected somewhere in here or that's 3 and they're out. And you don't communicate it. You don't say you have to be good. You don't say next time you got to do better. You don't say anything. They're just out. At the end of 3 minutes, they're back in. And when they come back in, you don't talk about it. You don't say you got to be better. At the end, when they're back in, they're just back in. So I want to make sure, Master Samward, if there's any questions about that, this is a really important time to ask any questions. So again, there's no discussion about it. There's no negotiation about it. So in this space, there's no talking.
Yeah, you shouldn't even have to say 1. Just hold up 1 finger.
Once this happens one time, I did this at one school. They were like, well, how does that work? And I said, well, let me go show you. And I ran out and taught the class. So there was one kid that they were having problems with. And I said, I did it once. I said, that's 1. I didn't explain it to the class, by the way. So this doesn't mean when you implement this system, you don't explain it to anybody, not even the parents. You don't explain it to anybody. You don't say a word, not a word. You just, the kid wasn't behaving. I said, that's 1. He looked at me like, well, I didn't say anything else. I just said, that's 2. He still wasn't behaving. I said, that's 3, you're out. How old are you? 5? Okay, you're out for 5 minutes. Sit down over there. I didn't have him sit with his parents because he was big enough to figure it out. I said, sit down over there. He's like, huh? I'm like, sit down. And then I started teaching the class. And at 5 minutes, I said, okay, you're back in. And then he misbehaved a little bit. And I go, and then he behaved.
Right.
I did not communicate a word. This is a class, wasn't even my school. It was in New Jersey. It was a class of about 30 kids, 3 to 6 year olds. And I did not explain a word. You should not explain a word, by the way. This isn't something you roll out. This is something you do today. This is something just do now. Now, by the way, you rarely have to count anybody because mostly you're going to handle it with correction in this. Now so hopefully everybody understands this. If you don't understand it, please email me. I'd be happy to set up a time to talk to you about it. I've done seminars with this. If you want to round up a group of people and do instructional seminars, we can organize something like that. It'd be nice to do live, but because of this venue, this is the best I could do right now. But this is something very, very easy to implement. I'm going to give you a book also recommendation that'll help you with it. But this is one of the most important things you're going to have. If you don't have a consequence, your entire discipline system is faulty. It cannot work. You cannot have discipline in any, by the way, if you're parents, you cannot have discipline at home unless there's an ultimate consequence of not behaving. If you're just going to try to negotiate with people, it's impossible to have a consequence. It's impossible to have discipline unless there's a consequence, because correction will work most of the time. But ultimately, if I'm smart, I'll just be like, yeah, whatever. There'll be some people that will do that. And you have to be able to have that. And once you have that, it tightens all your discipline up. Now, by the way, you can teach this to parents, or once you model it for parents, they will be fantastic. They will be fantastic. They will love it. But you have to model it for parents. And you have to do it that way. So again, the way the count starts is once the behavior gets bad enough, that's 1, that's 2, that's 3, and you put make sure you physically put the fingers up, because later you want the students to know. With my son, he's 17 now, and even with my son now, if he bothers me, I just go like this and everything stops immediately. And I probably haven't had him have a consequence since he was 6. There's been no consequences since he was 6 like this. He hasn't had a timeout kind of thing since he was 6. Anybody who says the timeout thing is not working, or there's some psychologists that argue about this, they're just wrong. They haven't implemented it right. So this system works great. Now, here's the big magic. So that's not the magic. Even though the book 1, 2, 3 Magic talks about it, that's not really the magic. So the way to make this magic work in a martial arts school, I'm going to tell you the way to make the magic work in a martial arts school. Here's the magic. The magic is these actually make sense to you. Probably. What the magic is actually is this one. This is the magic. Because what people forget about and never ever do, almost everybody, is the target behavior. The target behavior, when everybody's doing things right, people just teach. And what should happen is there should be massive reinforcement. Massive positive reinforcement at target behavior. Massive positive reinforcement at target behavior. Very frequently, class is going great. Instructors just teach. All the time. Give you an example. I talked to some elementary, when I was doing my schoolwork at the university, I was dealing with teachers a lot, and I would ask teachers all the time. I said, well, do you guys ever positively reinforce kids when everything's going great in your classroom? And they all said yes. And I said, okay, great. And I said, well, when was the last time you did that? And they would give me examples. And I'd say, well, was that happening when everybody was doing great, or when somebody was doing something wrong and you noticed that, so you reinforced the kids? And in every single case, they would always admit to me that no, it actually was when this kid was doing something wrong and I noticed it, so then I would reinforce the rest of the class. We almost always notice positive when it's in contrast with a negative. So what you're really doing when you're reinforcing is doing this one. You're almost always doing this one. And that's not a negative on you guys. That's not bad for you guys. That's just normal human behavior. We normally don't notice it when we're full and satisfied. When class is going on and everything's great, we just normally don't. It's just great, and now we can keep teaching. Now everything's going good. Everything's great. Let's keep going. Let me teach you some more stuff. It's hard to remember when things are going great. Man, this is a great class. I can't believe how good you guys are doing. And in a way, that's when it's the most valuable, and it's the most important time for us to reinforce how good everybody's doing. But we mostly forget it. So what I want is I want my target when I teach class to be this little t. You can't even see the t. I want my target behavior to be this little tiny thing. I want my target to be this really, really, really tight target behavior. And I want to be reinforcing that, so that I hardly ever have to have off-target behavior. And then I want my off-target behavior to be this little circle. And then if they're off of it very much, it's this, and then up. And what is going to happen is, imagine that world. Is this going to be a strict, like a crazy, like mean world? Or is it going to be fun because we're all getting a lot of reinforcement and everybody's doing it right? It's actually going to be a really fun, reinforced, and everybody's doing it right kind of world. This is more fun, but it's a lot more disciplined. So fun and discipline go together. They're one and the same. They're not opposites. So remember, we started this. The way to make this work better, the secret is high discipline equals high fun if you follow the system right. How does that work? The system is something that's very tough to do. The hardest thing is to massively reinforce when they're doing it right. When everybody's doing it right, Matt, remember to, wow, you guys are all doing it right. Oh my gosh. That's true of your staff, true of the parents, true of the students, everybody, all the way through. Okay, any things to add, guys, or other questions that maybe are up there that we haven't answered yet?
Yeah, so we're having a lot of conversations about people, kids that are so disruptive, and then what if the parent is not there, or they're in with a grandparent or an older sister or something, but the kid is so disruptive that even when they get set out of class, they won't sit still.
Well, okay, so there's two sides of that equation, and Master Olson can also jump in for this. So the kid's so disruptive, and they're just like a terror in class. And so you sit them out, and then they're even more of a terror, and they start running around. They could be really, really bad. Well, that's a time where you have to escalate potentially, number one, and then have a discussion with the parent. An immediate call at night and go, we need to have a discussion because your kid is being disruptive, and we don't allow that in our class. Well, what do you mean? We don't allow that behavior. The other part of it is, that's one. The other part of it is they may need a private lesson. So that the private lesson would be, and if we tell them they need a private lesson, we won't charge for that. Now, if ongoing they need private lessons, as I mentioned before, that might be an outcome. We will charge for that, and we'll generally charge $150 for a half-hour private lesson or more. And they have to be in one of our higher level programs to even get private lessons. Maybe they have to have private lessons until they can get acclimated enough to be able to behave. So
I would say, I'm sorry.
Go ahead.
I would say that, if that's the issue and the family members aren't there, a parent or guardian or somebody, when you make that phone call, say, we really want to work with you and help you in this area, but we are going to require that you be here during the class.
That's a great third.
They just have to be there. I mean, you can't. I always try to look at the other side of things too. You have all these children who are behaving, and they're not getting what they are paying for and deserve if you're allowing this to happen in your classroom. You're not helping anybody.
Mm-hmm.
So.
Yeah, and what I prefer to do, and so everybody's clear on the call, is tell them what's going on and tell them we just need to sit down together and talk about it. So I'm not going to have that conversation on the phone.
Right.
Right. We require that both parents come in. Sometimes it's a divorce situation. And if you got to just figure out what to do. One parent may not, and they could be in another state, or they may not be engaged, but you got to figure out the best way to handle it. But they need to physically come down and talk to you. So it's not, and if they're physically coming down and the kid's there too, then it's like, look at the kid, I mean, you can tell what's going on right there. And you can also talk about, a lot of times what will happen there, if it ever turns adversarial, one thing I'll tell you right now, and the One Tooth Magic book will help you with this, even though it may be upsetting, because you might just be frustrated with the kid. So we have to remember our rule about, and this is something maybe to write down, the emotions you express should be the emotions that they need. Not what you feel. That's the rule as an instructor. We're instructors. Sorry about my handwriting, by the way. I'm going to blame it on the whiteboard thing. But the emotions that you express, you're an instructor. You're a high-level person. You're a mentor. You're a leader. So I'm not saying you don't have emotions. You can call me if you need to, or email me and we'll set a time to talk about your own personal emotions, or talk to your family member or your spouse or your other instructors. But as far as your students go and the parents, the emotions you express have to be the emotions that they need at that moment, not what you personally feel. I am there with you that it's very frustrating when a kid is going nuts in class and running around and you will not behave. I get it. I believe if you follow this discipline system, you will have much less of that. You will have much less of that because it works, and it will make your life better, and you will feel much more in control of what happens by 10 times. You're still going to have a kid once in a while that does that anyway, and the parents may or may not be part of the problem. And having the conversation with them is going to be really important, and they may not. It may be a negative conversation, and they may say, well, why aren't you fixing that? And there may be a negative thing, and you have to keep your emotions in check and understand that the best way for this kid, the best way forward for this kid and for the family is that they do martial arts. I mean, unless you really want to get rid of them and they're jerks, which is also an option. It's also always an option. And I don't dissuade you from doing that if that's the case. I don't want you to work with anybody that you don't feel happy about working with. And you should consider that if that's the case too. But if you do feel like this is a positive thing for them and it's just a miscommunication, then make sure you help them understand that what we really want is, I think Master Olson said a while back, is that we want to have an outcome for this kid so that this does work for them. And imagine what would happen if this behavior continues on to, junior high and high school, and goodness sakes, when they're an adult. And when they're an adult and they're still having trouble concentrating and they're still having trouble focusing on what is going to be best for them. Imagine how that's going to be when they're an adult. If you just stop and shut up and let them think about that for a moment, that's a pretty big deal. And if they think about that, then what we want to do is help them with that. And so for them to have that, they're going to be in class. We may be doing a private lesson with them, tomorrow or right now. We're going to see how they do. And then in class, if they have a problem, we really require you guys to be here so that whatever, and then we can kind of move from there. So hopefully that answers the question, Master Sanborn, that they were having. Any other questions specifically on this? Because we have a couple other things really quick to cover, and then we're going to wrap up because we're over time right now. Any other questions that are big on that? Nope, you're on mute. So if you were talking, we can't hear you. Okay. Oh, this is weird. Okay. Oh, okay. I'm gonna maybe I'll email these out. I don't know if you guys can. You don't really need to write these down, but if you go to mastermoody.com, again, this isn't a good go-to karate website. I'm embarrassed that because it's just one that I threw together. You really should go to gotokarate.com/2019 for some really great examples and to get your online marketing tripled. I mean, at least. I mean, Master Olson can vouch for that. What happened for her? She's nodding her head there for you, but these are some of the books. Now, 1, 2, 3 Magic. Everybody that works with kids should be memorizing this book. I probably reread this book every year, even though I probably got it memorized. This book is essentially the system I just taught you, but I taught you with a modification for martial arts. So this is how you use it in martial arts, but you need to read this book as the foundation. This is the beginning piece of what I taught you. You need this book, and it's at the book club. So you just go to the book club, go to mastermoody.com and click on book club. This is Master Olson's book, and there's a link to get that. You can get this from Amazon and this from Amazon. You can get my book, The Life Skills of Leaders. Of course, I recommend that book. I don't think I even make any money from that. I just do it at cost so that you guys can get the book. And then right here, there's a link for The Way of the Mile High Maverick by Master Oliver. This is a really important book for anybody that, if you're a school owner, if you're not a school owner, you don't need it. If you are a school owner, you must have that book. These are 4 books you've got to have. So write the names of these books down right now while you're listening. They're very inexpensive books. get these 4 books. If you own a school or you're an instructor, if you're an instructor, you have to have these 3 books. You have to have these. We're not doing this webinar to sell the books, guys. I mean, money doesn't go to us. I think both of us are doing these basically at cost, right? Because we want to get the books.
Right. Right.
I mean,
Right.
I'm really not making that up. I mean, it really is. And then this one is free. So nobody's making any money for that. So that's not we're not pitching anything, but you need these books. We're doing this so that you guys get these books. Well, we're doing the whole webinar to help you, but these books are critical for you to have. If you're a school owner, you have to have this book. If you're an instructor and not a school owner, you have to have these 3 books. Okay, so you really have to have those. So just go to the book club, and there's like 50 books on there. So just make sure you write down these 3 so you know which ones. You can get all the other books if you want. I mean, there's plenty of they're just recommendations of ones that I recommend, but get those 3 for sure. I mean, those 4 if you're a school owner, okay? But those are really critical ones for you to get right away. Let's see. So marketing, really quick. If you're not putting ADHD on your website, it's 3 times the internet search traffic than bullying. That has to be a bunch of content on your website. And bullying beats martial arts 5 to 100 times to 1, depending on your area. Some markets, it's 100 times the traffic. So that means ADHD is 300 potentially the traffic to martial arts. It's way bigger than anything martial arts related. And you need a professionally designed ADA specific platform. Again, Go-To Karate is your go-to for helping with that. Literally your go-to. So use them. They're the only professional company really in the industry. We can tell you that a bunch of different ways. I do work with them, so that's full transparency. There's a lot of ADHD specific organizations. You should be asking around in your neighborhood. You can do a lot of marketing with them. And there's probably a billion other things you could do. We just don't have time for it today. In sales, make sure you do a proper introductory lesson. Martial Arts Wealth Team can help you with that. If you're not doing an introductory lesson and you're just tossing kids into class, this will not work. There'll be nuts in class. Like a lot of systems, you guys enroll them and do a $49 intro or something, and you toss them into class, and then you try to sign them up later. That's just broken. It will not work for this group of kids or for any kids with any kind of problems. You need to have a professional sit-down one-on-one lesson. And then if you're not enrolling 80% of the people that walk in, I don't mean 80% of the ones that do your intro. I mean 80% of the people that walk in your door. If they come in your door and you're not enrolling 80%, then the system's broken. You have to have a professional introductory lesson. So that's a measurement you guys should be using to know that's not working. MartialArtsWealth.com has some tools. They're free. So go there and use those tools at least to get an idea. If you want to work with them, you can. You should, but if you want to, go ahead. But there's some free tools there that'll help you with that. But those are some measures. If you're not doing a proper introductory lesson, you can't toss these kids into class. It just won't work because you're not getting enough information from the parents to properly acclimate them. It just won't work. And as far as upgrades or renewals or whatever you call it, the leadership program, whatever you call your higher level programs, this is a reason they should do it. So if there are 2-3 weeks in your program, whenever you do your renewal or your upgrade, if you're going, well, I got to wait on these kids because they're crazy. No, if they're positive and the parents are positive and you got them excited, then this is like, if they don't do the higher level program, it's even more of a loss for them. So this is a reason they need to do your higher level program. So it's counterintuitive for some people, but you need to get them ready to do the higher level programs, and they should be doing the higher level programs. This will help them at a more accelerated rate. So don't be, I'm sorry to say, wimpy when you're thinking about enrolling them to higher level programs and making them make commitments to black belt. This is even more critical for these guys. It's more important for these guys. I'm really passionate about this because don't wimp out on these guys, people, please, because the ones that don't move up to these black belt level programs or whatever you have, if you're jiu-jitsu and it's longer, whatever level programs would be higher level, get these guys enrolled in the higher level programs because these guys are ones you really do need to save or we won't be helping them the best way possible. Okay. All right. So summary, finish up. You learned some things. Hopefully you learned a lot about ADHD. Learned hopefully how to speak with parents. I think that was a great segment with Grandmaster Smith and Master Olson, Master Sanborn. And hopefully you learned a lot about instruction. I hope that discipline system was valuable. To me, that's the most important thing we learned today. If we get to send the video out, you should repeat that and buy the books. Get those books that we talked about, 1, 2, 3 Magic, Master Olson's book. You can get my book if you like, and then get Master Oliver's book as well. And then these kids are great. If you use the discipline system and you have high standards in your school, the higher standards you have, and the more you push the level of these kids up, the more success you're going to have with them. So make sure you use that system, and it's going to work for you. I hope everybody has gotten a lot out of this. Master Olson, Master Sanborn, you have any last comments? Master Smith had to leave for another seminar.
I just wanted to say, in terms of these webinars, how they've kind of helped boost the value of our program here at the school. I was talking to a parent the other day who has a child with autism, and I was telling her about, how our staff attended the last webinar about teaching martial arts to kids with autism, and she was just blown away by that, and how impressed she was that we cared to look into doing a better job and helping her child. So I would say use these, telling your students, telling the community that your instructors are training in some very high level curriculum to help them become better instructors.
Thanks. Thank you very much. No, I appreciate it. And that's a good point. Telling your staff, telling your parents, or letting people know, or even telling your instructors, or making them watch this stuff. Make your instructors watch these videos, because 99% they should know this stuff. And if you're doing it, then they'll feel more important, and they'll feel more educated as instructors. That stuff that I never got this. I never got this when I was training. It was pretty much my instructor tossed me on the floor and left. That's how I got to learn to be an instructor. So Master Sanborn, did you have anything else to add?
Yes, sir. One of my best up-and-coming instructors was diagnosed with ADHD before she came in 5 years ago. And now she's on the floor teaching because she went through our program and we followed all these rules with how to do the behavior. And her mom never put her on medication, and because she really was against medication for her. But now she can focus enough to teach class, as well as she's getting ready to go to high school.
That's perfect. That's awesome. Yeah, and we can take them not just without medication, but to a way higher level than their parents would have ever thought. People don't understand this. We don't just take them, we just don't save them from medication. We take them into the stratosphere of what they could do. So it's beyond successful. I'm really excited about it. So this is so much to be excited about. I hope everybody on the webinar got a lot out of it. Thank you so much, Master Sanborn and Master Olson and Grandmaster Smith for the time he was on. And sorry, Master Thomas, Master Oliver couldn't be here, but I know they were here in spirit. And thanks, everybody. Make sure you go to martialartswealth.com and go to karate.com/2019 to get those other resources and get those books as well. And I hope everybody has a great day.
Thanks.
All right. Thanks, everybody.
Thanks, sir.
Thank you.